This is the Determination of Brain Death and Family Communication Physician Training Program, developed by Gift of Life and Tipping Point Media. This virtual reality simulation is broken into 3 parts. In part 1, physicians learn how to have clear and concise conversations with grieving family members. Here, users meet Carolyn, the patient's wife, and explain the upcoming brain death evaluation with her.
I see. He hasn't shown any brain function yet, but he still could be okay, right? I mean, it's still early. What else can you do for him?
Users can choose from multiple options, either by tapping the screen or using voice recognition powered by artificial intelligence to practice vocalizing their responses. The effectiveness of their choices is reflected in the effectiveness meter. Carolyn's responses change based on user input and are fully animated and voice acted. In part 2, physicians undergo a fully simulated bedside neurological exam. Users enter a 360-degree virtual reality hospital room, complete with a full brain death criteria checklist, modeled after the ones used in real-world hospitals. Physicians use interactive gestures like tapping, swiping, and dragging to simulate the steps of a brain death evaluation. Then compare those results against examples of brain death criteria. Then, users check off each test as it's performed based on their observations. The application has 2 engagement modes that users can toggle between using the menu. In focus mode, the camera is locked in place, allowing users to focus their attention and complete tasks effectively while their device sits still. In 360 mode, users move their device and their body to gain a 360-degree view of the room and the procedures as they happen. In part 3, physicians complete their brain death evaluation with an apnea exam, which tests for a patient's ability to breathe without assistance. As in part 2, users have access to a full brain death criteria to document their findings and full use of a 360-degree hospital simulation, which they can use to adjust the patient's breathing, run blood tests, and complete their evaluation for brain death. Feedback from subject matter experts and early adopters, most of whom are senior-level hospital leaders and directors-in-chiefs of their hospital divisions, has been overwhelmingly positive, proving that this application has revolutionized how to approach training on sensitive topics, like brain death, and highlight the true potential of utilizing virtual reality simulations in healthcare to train physicians.